Hello dear students, Ms. Khan here again. Today we're going to talk about ethical and legal considerations in promoting mental health. As we know, in mental health, our patients are very vulnerable and it's very important to protect their civil rights. Therefore, the nurses who are serving patients in mental health, they should be very well informed about the legal considerations and ethical considerations as well. Oops, I'm sorry, my laptop just slipped, but never mind, the show must go on. We'll keep going. So we will be meeting some objectives, which are actually they are very important objectives. It says a lot of definitions, but we are defining the terms that apply to legal issues in psychiatric care. We will defining and applying the concept of least restrictive alternative to restraints. Restraints are also very important. Uh, this is a very important issue. Restraints are very important issues. Confidentiality is very important issue in mental health and in healthcare overall that we will be discussing. And also the right to treatment and the right to refuse treatment is very important. So we will be touching on very important topics here. So first of all, legal rights of our patients in mental health setting. That's what we'll be discussing. The most important thing to remember that the patients who have mental health disorders here and they are receiving care in acute care settings for mental health problems, they have the same rights, same civil rights as any other citizens. We have to keep that in mind that having a mental health issue by no means diminish their rights as their civil rights as any other citizens. So be cognizant about it, treat them with the same kind of respect and dignity as you would any other citizen or any other patient. They have a right to have informed consent and they have a right to refuse treatment too. We cannot force them to seek treatment or we cannot impose any treatment without their will. They have a right to have a written treatment plan. They have a right to be a participant in their treatment plan and then follow up. And they should be willing to be they should be willing to seek that treatment. They should be willing to make decisions in that treatment plan. They should be active participant in that treatment plan. They should have a right to have their information confidential. We should not be, nobody should be sharing their information, either written or spoken in public. They have a right that their information with their permission could be communicated with their attorneys or other healthcare providers or their families with their permission. They have a right to provision to have adequate services and adequate treatments. And just like I said, they have a right to have respect and dignity without any discrimination. If they need any interpretation, if they do not understand what the treatment is, they have a right to have those services. They have a right that they stay free of any kind of harm, any physical, emotional, or pharmacological restraints. They should be free of that. They should not be subjected to seclusion or any kind of physical or mental neglect. And we would talk about neglect in a little bit. They should have a psychiatric advance directive in place that should they be subjected to any involuntary admission, then an psychiatric advance directive should be in place that somebody, a proxy, could make decisions on their behalf. And they have a right to have provision of care with least restrictive interventions. And when they are not just so as long as they're not threat to themselves and they're not threat to anybody else. So these are very important points to remember so we can actually safeguard the rights of our patients who have mental health problems. Now, how do we know which resources we seek out when we need to follow up on rights of our patients? We we actually look at Code of Ethics for Nurses. You can actually look them up at American Nurses Association website. You look at Patient Care Partnership, that you can look at American Hospital Association website. You can look at legal advice from attorneys. You can look at your facility policies, other members of healthcare team, and all the hospitals have ethic committees, and then members of clergy and other spiritual counselors. I want to talk about some basic terms that are relevant to bioethics. One of them is autonomy, which means that your patient should have a right to make decisions about their care. And we should empower our patients. They should be active participants in their care. Another term is beneficence, where we have an obligation to do good to our patient, take positive actions to help them. And another term that is closely related to beneficence is non-maleficence, which is doing no harm to our patient. Under no circumstances we should harm our patients, and we have to keep in mind that we should do our very best to intentionally or non-intentionally not harm our patients. Just as we should be fair to our patients, we are obligated to take care of multiple patients at the same time, but we should try our best to be fair to all of our patients. And fidelity is we should keep promises to our patient. When we take an assignment, we make a promise that we will be taking care of those patients. This is a promise. It's a binding contract between you and a patient that you are assigned as a caregiver of that patient. So you should be loyal, and you should keep that promise that you will do your best, the very best. You will give it 100% to make sure that you will take care of that patient to your maximum potential. There are civil and common laws issues in mental health. The tort is actually, it's a difficult term, and it has a lot of components, but I'll try to make it real simple for you. It's a civil wrongdoing which is made against a person or a property, and they are classified as intentional and non-intentional. And I will just keep it very simple. I will tell you a few. Intentional, there are a few types. Assault, a lot of people confuse assault as a physical harm, but assault is actually an intentional threat. If I tell somebody, oh, I will give you an injection if you tell a patient, just to threaten them, that's an assault. But when you physically actually give them an injection against their will, if they refuse, that they do not want an injection, and you physically give them an injection, then it's a battery. So just be very clear about the difference between an assault and a battery. Assault is an intentional threat, but battery is an intentional physical harm or physical contact with a patient. False imprisonment actually is just restricting a patient or restraining a patient against their will when it's not indicated. That's false imprisonment. There are unintentional torts, and one of them is negligence. Negligence is actually a conduct which is demonstrated in terms of below the standard of care. When you're providing care, when you think that you're providing care, but you're actually not even meeting the minimum standards of care, that's negligence. And malpractice is when negligence is a professional negligence, then it's malpractice. And there are consequences of torts, whether they are intentional or unintentional, but nurses are held responsible for them, they're held accountable for them. Restraints. Restraints are also very important, and we should be very mindful about them when we apply them for our patients. First of all, you need to have a physician's order, and they are only to be applied to ensure the physical safety of the patient or the other patients. They are not to be applied for your convenience, and you have to only apply them when all less restrictive interventions have been exhausted. When you have tried everything else, and restraints are your last resort. And only on the written order of a healthcare provider, like I said, the regulations also describe documentation of the restraints, and then you have to have follow-up assessments, which include the assessments of circulation, assessments of motion, assessment of patient's mobility. Also, patients should be provided nutrition, patients should be provided breaks to move around, patients should be provided breaks to use the bathroom. So those are the regulations that you should always be aware of. Every facility and every state has regulations about their restraints. Also, you cannot just get as needed order for restraints. Okay, a patient has not done anything, patient is calm, and then you just want to ask the doctor, okay, can I have a restraint order for the future? You can certainly not get an order for restraint like that. So just imagine yourself, when I keep talking about empathy, empathy, empathy all the time, just please put yourself in that position, put yourself in those shoes, and do not restrain your patient unless you have exhausted all the other interventions, and it is your very last resort. Confidentiality. So we talk about HIPAA. What is HIPAA? It's a Health Insurance Portability and Accountability Act, and nurses should definitely know about it, absolutely know about it because of its impact on healthcare. You cannot share information about your patients, either spoken or written, by no means, because neither in public nor in social media, because there are severe consequences. And you can only share information even with your patient's spouse or very close relatives, only if the client allows. And I will give you an example. If you are actually interviewing your patient, if you're assessing your patient, and if their spouse is present or if their loved one is present, their family member is present, I would highly recommend that you ask for your patient permission, that if they should be in the room, if they should be present in the room while you're interviewing them, you should discreetly ask your patient that do you want them to be in the room, and if your patient says it's okay, then continue with your interview. Otherwise, you can ask the family member to leave. And when there are certain mental health issues are involved, it's even more important to maintain the privacy and confidentiality for your patients. And there are certain guidelines and certain exceptions where you can actually break the confidentiality, where there's a duty to warn and protect third parties and the reporting of child and vulnerable adult abuse. Consent is also very important. When we talk about consent, we need a patient's consent, and it's necessary in several occasions. It's necessary for the admission in a facility. We need a consent when there are some invasive procedures that are being conducted, such as placement of a central line. If there's a surgery involved, there are some treatment programs, sometimes chemotherapy, sometimes there are some very high-risk medications involved, or some research studies in mental health. So a consent is always required. But what is a nurse's responsibility? It's never your responsibility to obtain a consent. But as a nurse, it's your responsibility to ensure that the physicians are actually explaining the risks and benefits to the patient prior to obtaining the consent. Also, it's your responsibility to witness the consent and witness that when the patient is signing the consent, they're mentally competent to understand the risks and benefits. So as a nurse, this is your responsibility to witness. So your sign would actually validate the fact that when the patient signed the consent, they were mentally competent and they knew all the risks and benefits and alternatives, and they were aware of everything prior to signing the consent. And it's a big responsibility, so keep that in mind. And I will tell you from your experience, many times from my experience, many times you will be forced and pressured by the physicians to obtain a consent. And boy, do I have stories to tell you. I can go on and on and on, but my recording will get so big and it will be a long, long download. But do not put yourself in that situation. Speak up for your patients, be your patient's advocate, and tell the physician, doctor, with all due respect, I will be more than happy to be by your side and I will witness the consent, but I will need you to be here and come and explain the procedure to the patient and explain them the risks and benefits and the consequences and alternatives. So be your patient's advocate. So there are also federal statutory issues and then advanced directives and are also important. Sometimes they're important for the patients, the living wills and healthcare proxies, when patients become mentally and physically incapacitated to make their healthcare decisions. So advise your patients about them. It's always a good idea. So this is just a tip of the iceberg. I just wanted to give you a brief review of some ethical and legal considerations in mental health. Of course, it can become rather involved, but this is a very good review. Feel free to contact me and ask me any questions in our face-to-face encounter when we will have it during this week, and feel free to reach out to me if you have any questions and concerns. All right, until next time, ciao.